Hey everyone. So for those of you working in-house pharma, agencies can sometimes be quite frustrating, right? Sometimes they're really slow, other times they make mistakes, they're inaccurate, right? The good news is Tom and I have an agency collaboration, and we've realized that we're actually twice as fast as most agencies, and we're 60% more accurate. So if you'd like to learn more about that, just scan the QR code, and what we'll do is we'll schedule a call with one of our sales reps to talk to you about that service. Obviously, I'm kidding, right? But I'm trying to make a point, because in pharma, we do this all the time. We lead with key messages about our product features and benefits, and we think just because we're X% better than this or Y% better than that clinicians will listen, they will trust the information that we provide, and they will want to spend time indulging in our information about products. But as you can see with my example just there, sure, maybe I got a couple of key messages off my chest in the first 5 minutes, but is that commercial impact? No, because nobody wants to engage with me. So why do we do it in pharma? Trust is really important. You need to build trust before you can start selling things to people. And that's just basic marketing. But in healthcare, it's even more important. So I want to talk a little bit about that. How many of you guys have used ChatGPT or Google, say, for example, to diagnose a health condition, right? For a loved one or for yourself? Everyone, pretty much. And does it make you feel any better? No, usually not. It's pretty stressful because you get all sorts of conflicting information and you don't know what to do with it. But what does make you feel better is when you go and see a healthcare professional. You talk to a doctor, they spend one-to-one time with you, they listen, they understand what's wrong, they tell you about their experiences, and they give you some options. And you walk away feeling like a weight has been lifted. You feel a little bit relieved, you have some options, you know what to do. So for that reason, it's really important that you trust the doctor. And I just want to highlight another example now where that trust can break down. So this is Evan Smith. Evan Smith was a sickle cell patient. He walked into a hospital in the UK, suffering from a vaso-occlusive crisis, a life-threatening condition for sickle cell patients. He was a young black kid, right? And he was stressed, and he was confused, and he was asking for pain medication. Obviously, the clinicians, didn't really listen to him. They put him in a side room. They didn't really think anything was wrong with him. Maybe he was a drug addict. And Evan had to dial 999 from his hospital bed and then later died, right? So when situations like this happen, certain communities don't trust the NHS or the health service, right? And that's a disastrous situation. There are patients with sickle cell disease who won't go to hospital even if they have a life-threatening condition because they do not trust the information and the recommendations that they will be provided. In my opinion, trust is the foundation of informed and confident clinical decision-making, whether you are a patient or a healthcare professional. And we are in the business of sharing valid, valued information about products on which healthcare professionals can make decisions. So we need to think about that when we're doing our marketing or our medical affairs communications campaigns. So we need to think about what it is that will allow someone to trust information that we provide so that they may have a chance at using our products. And there are 3 key elements. And if we think about the healthcare professional interaction, it can help you understand that. So the first is empathy, right? So you demonstrate that you understand me. You understand my key problems. You understand what I'm dealing with day to day. And you demonstrate that through your interaction. The second thing is value. So it's not just value in the products, it's value in that moment. So every email you send, every campaign, every website, every event has to offer immediate value. You need to demonstrate your expertise to show that you can provide value so you can basically earn the right to talk about your product in a confident way. And the third thing is experience. So no matter if the consultation is good, the information is good, and they've demonstrated empathy, if it's an absolute nightmare to get in touch with this person, it takes weeks to schedule a call, if it's a shoddy process or the building that you enter is a mess, then you also don't trust the business that's providing you with that information. So I'd recommend if you want to build trust through your marketing, you have to demonstrate empathy, value, and experience, and provide a good experience in every single interaction. So where are we right now as an industry in terms of engagement and building trust? Well, you've seen all these stats already in various formats, but basically, healthcare professionals are overwhelmed with our content. They think it's too product-centric, so we're bombarding them with too much unsolicited sales-based information, and they feel that we don't really understand their needs completely. So we're not doing a great job at the moment in terms of building engagement with our digital content. And then, the stats speak for themselves. I mean, like, only in the UK, only 16% of healthcare professionals have visited a pharma website in the last 90 days, showing that they don't really use our content to make decisions. And also, this audience is pretty burned out. They spend a lot of time on admin, so even more reason not to bombard them with things that they don't want. Now, I think that trust is the answer to solving this engagement problem. We're all here because we work in healthcare, and the products that we sell or provide to patients can change lives. And I think that pharma brands could be the most authentic and trusted brands on the planet with the good that they can do. But we're just not in that situation. So how do we get there? Well, I think that there are 4 key things that we can focus on. There's obviously others, but these are my recommendations. The first, we all agreed earlier in the day, mindset is super important. The second is thinking about the engagement models we use commercially. The third, insight, again, something we all agreed on, but making sure that it's super contextual, so we understand the day-to-day of our customers and their patients. And the last thing is something we're really bad at, which is being accessible and discoverable with our content. So let's start with mindset. And this is a mantra that I use and we use in our agency that I recommend you all take into consideration. Your customers don't care about you, your products, or your services. They care about themselves. And if you stick that above your laptop or whatever, and every time you review an asset or create a campaign, if you think, am I talking about myself and my products, or am I adding real value for a customer in this interaction, then you'll make an immediate leap forward, in my opinion. And this quote is by a guy called Joe Paluzzi, who wrote a book called Epic Content Marketing, which I would also highly recommend if you're into reading about marketing. The next thing I want to explain is an engagement model that I think that we should be using more often. And this is an inbound engagement model. It's another flywheel. We've already heard about some flywheels today already. But this is simple. It simplifies omnichannel and a customer journey. It's impact-driven, so you can measure success. And of course, it's customer first. So you'll notice there's 3 key stages, and all you have to do is have a clear strategy and process at each stage. Stage 1 is the attract stage. All you need to do as a marketeer there is attract people to your ecosystem. You need to provide them with valuable resources or content or experiences that solve customer problems, so you get their attention and they can engage with that content. And in exchange for those content, experiences, or resources, they can provide you with an email address and also maybe a key insight about themselves or about a problem that they can solve, so that you can get that information and you can use it to sell later in a really relevant way, okay? So you don't need to talk about your product at this point. You just need to talk about solving customer problems, right? And you can do that in any way that you wish, and you can get creative with it. Once you have that value exchange, you have somebody's email address. I call them a subscriber rather than someone who's consented to be bombarded with promotional content, because you treat subscribers nicely. And then you can nurture them, and because of the insight you have, you can sell your product in a relevant way. This is what we all called omnichannel. But effectively, we can say, we know you have X problem, and maybe my product is part of that solution, okay? And then the third stage, as Wayne Simmons says, it doesn't end at the end of the funnel. Then you provide support. So you just need to have a process to support customers with their first patient, their second patient, make sure that they have success, give them all the resources they need to overcome adverse events and access and things like that. And if they succeed, they'll become confident. If they become confident, they'll use your product more often. And then you can engage them in advocacy, and they can make this attract stage more authentic by co-creating content with you. So you have a full flywheel, and it's an inbound approach rather than advertising. So a lot of companies have done a really good job of that. I'll give you a few examples of companies who have done a good job of inbound. This is HubSpot. They are a CRM business. They do not sell their CRM by telling you about its features and how much better it is than other CRMs. They tell you how to become a better marketeer. And they have loads of great content and resources. They have a full academy with thought leaders on social media, marketing strategy, communications plans, SEO, whatever you want, PPC. You can see these types of videos here. They also have worksheets where you can plan out your campaigns. And then they also have an event which talks about the trends of marketing. Noted, they don't talk about their product. But what they do is they give marketeers a chance to learn from them. And when you interact with something, say a social media planning campaign, they can then engage with you and just show you how their CRM system can help you with social media specifically, because that's your interest. And also, when you do decide to have a CRM system, are you going to go to the company that's been bombarding you with key messages about their product, or are you going to go to the one that's designed a product for expert marketeers like you that you trust? Another one is Lego, a little bit different, but this is from a branding perspective. You don't buy Lego because of the quality of their bricks necessarily. You buy it because of the brand. And just to show you an example of how Lego might produce a leaf piece, this is a brochure that Lego would leave in a store. It's a game basically for kids to help them do creative play. So that's for free. You pick it up in the store, and when the kids play the games, they have to build something, and then you can link off to the products. So basically, Lego is not trying to sell the bricks. They're just showing you they understand creative play, and therefore, if they understand creative play, then their toys must be good, and you will trust the brand. So what does this look like for Pharma? This obviously isn't a real brand, but these are kind of examples of the kind of thing that you might want to do. So the way that I would imagine Pharma websites and digital content would no longer be about selling the product and the key messages and the efficacy and the safety and all that. This is in depression, for example. If you're selling depression treatments to healthcare professionals, then maybe you want to solve problems. You want to show what patients are saying. You want to talk about how difficult it is to switch medicines. You want to provide tools, resources, guidelines, have an expert panel to help you to create that content, give them podcasts, resources, meet the expert opportunities, like you see in medical education, like you see medical affairs doing a lot. You don't need to talk about your product on your website. People can get that information elsewhere. And once you know that they're interested in something that your product can do, you can show them. Other kinds of things that you can do, so this is, again, based on a real example, but in the UK, pharmacists have taken on a massive role in terms of supporting patients with long-term health conditions because GPs and the NHS is overwhelmed. They're getting no support from the government, so a company that we work with decided we want to support them, so producing resources and tools to help them manage patients in the pharmacy with tools and checklists and looking at how patients are doing, providing free e-learning and also opportunities to have consultations where the company can provide them with some solutions. Now, with this approach, promoting that through LinkedIn, sending stuff in the mail to give access to this content, they actually had 300 rep requests within 6 months. Now, those aren't rep requests to talk about the product, of course, but that's an opportunity to start nurturing customers. It's an opportunity to start understanding what their needs are and introducing your product in a relevant way. So I would advise you, if you're working in pharma, consider how you might want to build trust by developing your own lead generation campaigns. One thing to consider, these aren't one-off campaigns, they're things that they must be always on. They must focus on customer goals, not your product. They must be unique, so look for something that someone can't get anywhere else and try and create that. They need to be accessible, so they can't be difficult to find or log into or access. They must be aligned to your product niche so that they solve a problem that your product also does so that you can see who's interested in that and then show them how the product might help. And then finally, they need to allow you to collect an insight about that person when they engage in the activity so you can use that insight to nurture them later on. So the question is, how do you know what it is that they want access to? I heard some people say before, well, you just ask them. I think it's really inauthentic to ask customers what they want. You know, for example, Apple didn't say, hey, what do you want now? And everyone said, hey, we want an iPhone, and they made one. You need to be creative and innovative, and you need to have real insights. But where do you get them from? Tom is going to help you understand that.
Yeah, thank you, Dan. Yeah, and just quickly, it's been interesting this morning with the talks about how 70% of HCPs feel burdened, don't they, by the content they get. But also we've heard people don't understand, as Dan said, what do people ask? How can we help HCPs? Because we're here to try and help HCPs. And then also we've obviously heard people talk about failing fast, iterating quickly. So hopefully I want to sort of try and pull those things together in the next few minutes and give you something tangible that you can give to your team or use as part of a strategy. But firstly, just want to talk through, make the point really that search, I don't think we deny this data. A couple of years ago, search was still seen as a bit of a dark space, but HCPs are using it. This data is actually about a year old, so it'll be higher now. But search is being used by HCPs to find out information, and you can get that data on what people are searching. Not every time, for sure, but enough data to give you guidance on what to write about and how to be helpful, whether that's through your Adobe or Google Analytics, whether that's through the Google platform where you're allowed through the Google Ads data and Google Trends, or through third party. So happy to chat about it later, but there's loads of places, and we've done it with clients where we've clustered content to create content strategies just using your own website data and industry data to answer the questions the HCPs are asking. But the challenge now we're finding is obviously the impact of AI. and how people are using that. And I know there's debate around it. And even Google today or yesterday on the BBC have come out and said, don't completely trust it. I don't think HCPs do completely trust it. But we ran a survey in partnership with Beacon. And if you've not heard of them, I call them sort of an AI-led healthcare research agency. And they've got over a million verified HCPs on the system. And they use AI to interact with the HCPs to get answers, and it's really engaging. So the responses you get are amazing. So if you need any of that data, we've actually got a full report on this QR code. If you scan that, there's a full report of all this data, which looks at what content people are doing. Are they searching by image, by voice? How's that working? I would scan and download it. There's loads there. Or speak to Frank. Where's Frank? Frank's over there. He heads up Beacon. What he doesn't know about HCPs isn't worth knowing. But if you want to download and share that with your team, I would. But the key message is, HCPs are using it and they're starting to engage more. And the younger they are, the more they seem to be using it. And again, you can get this data when you map it with your website and third-party visibility tools to understand what they're searching. And obviously, it's much more conversational. It's not sales-led. Okay, so we're talking about using sort of SEO and AI optimization as a listening tool, not a sales tool. But the reality is, and there's data everywhere now, people are searching across multiple platforms. This obviously varies by region. I appreciate in some regions we see social media much more prevalent and YouTube's much more prevalent, but you can get data from all these. You can answer the questions of what are people looking for, what's engaging. And actually, Dan, your stat about 16% only HPs, 16% visit your sites or Pharma sites. Part of that seems to be just because they don't show. They're just not findable. It's not even necessarily sometimes they don't trust it. They just don't find it when they search. And the challenge is, even if you're not maybe buying into AI as a way to provide information, Google's forcing it on HCPs now. I don't know how many of you use AI mode or have noticed Google AI overviews, which is the bit at the top, but that's literally pushing everything else out the way. So if you're not understanding what people are searching in that, you are going to be in trouble. But it does it impacts how you interact with HCPs. And just to give you an idea, because the AI overviews doesn't always show, you'd have noticed, but it does show a lot more with healthcare searches than it does with others. So we ran a scrape of Google where we put in over 7,000 healthcare-related search phrases, and 47.5% of the time, the AI overview shows. So you're not even seeing the Google search results a lot. And just to give you an idea of what that means, for travel, it was about 24%, and for retail, it was less than 10%. So really, for healthcare, it's really important. You're getting in the conversation, you're training these LLMs and these models, and you're being part of that conversation. And this is why we're talking about using it to get information, because you can't be involved in the conversation if you don't understand what people are searching. But if you do, and you can understand using your data and third-party data, you can answer the questions and be part of the conversation. But the challenge is a lot of people are still fixated on their website. And they spend hundreds of thousands of pounds on a website that often you don't even see, do you? So this is ChatGPT, AI mode, and then just Google's AI views, and the websites aren't even above the fold. Okay, you get cited on the right-hand side, and I want to give you some tangible ideas of what we've done with a couple of Pharma clients to get cited there. But this is the key picture. Once you can understand it, if you don't understand it, there's no chance of you being there to help the HCPs at their time of need. And if you're not there, you are invisible. But I'll come on to that.
Yeah, so the big challenge to all this stuff is you got to create loads of content all the time, which is pretty difficult. It's already difficult to create content for products, let alone all this added value content that comes up on search and all your webinars and your websites and stuff like that. But there is a way to combat that, and I think it's a bit of a mindset. So you kind of need to stop thinking like a brand manager about campaigns and start thinking like a publisher. Because if you want to show up with content, useful stuff when people need it, you need to be creating lots of it. Now, a publisher wouldn't think I need to do a campaign end to end and then measure the results. You have a cadence, right? So you produce content in a way that's efficient for you. I know, for example, you run a series of webinars. Every webinar you record, every recording you cut into 4 videos. All of those 4 videos, you take the transcript and make a little white paper for download and value exchange, and you make maybe 10 short 1-minute videos. If you have a cadence with a steering committee to do a webinar every month and have a process to chop that up and make it really quick, it wouldn't take you very long to do that process and do it quickly, especially with AI and stuff like that. You can create reports and things really quickly. I would highly recommend you think like that. Then you can produce lots of valuable content. You can start a community and you can build engagement with them. And don't forget, you've got to make that unique and innovative because you're in competition with everyone, not just the other brands for attention. Okay?
Yeah, and just quickly then, just to close, if you want to download, these tips are all going to be on this QR code as well. I'm just going to run through them very quickly. Structure is everything, okay? Most pharma, when we work with them, they have the content already. We just help them make it work harder. And if you want to do something you can implement in the next 4 weeks that doesn't sort of break everyone in the regs team and your marketing team, is look at physically the structure of your content. There's loads you can do under the bonnet, but we did some work with the pharma client where we literally just optimized how the content was structured based on what we understood people were searching about. And by structure, I mean, was it FAQs? Was it bullet points? Was it infographics? Was it a table? Was it a video? And when we just tweaked that, we didn't really change the content, we just changed the structure. They started getting cited in the AI overviews, and that started driving traffic. And although people are fearing this sort of 0 clicks world, when you do get the engagement, it is through the roof in how they then engage and stay on the site. That's a really simple tip which you can download. And just the last one quickly is just you can look at how AI crawls your website. There's multiple AI bots, okay? Some are for the search and some are for training the LLM. If you don't know which ones are doing which, when you get home, ask your tech team what they're doing and how often, because they're not crawling it very often, then you're not training the bot. But that's a quick way, because you can improve that. And that's a quick way to get you the bot. But do download the QR code.
Yep. As well as the AI research, we've also got all that stuff I said about lead generation, inbound. We've got a clear guide to that with all of the information there. So if you've been making notes and you want that, it's all there for free, and you'll get an email straight away with a link to all 4 guides and some extra content. So look, thanks so much for listening. Really appreciate your time.